Welcome to Brotherhood of Healing, the podcast devoted to supporting veterans in health, resources, and in life after the uniform. Here we share inspiring stories, valuable information, practical advice to help our veterans thrive beyond their service. Whether you're seeking guidance, community, or simply want to hear from those who understand your journey, you're in the right place. Thank you for your service and welcome to the Brotherhood of Healing. Tying on target now. Welcome back to another episode of Brotherhood of Healing. My name is Dr. Mark Rossetti, and today we're going to talk about something that's near and dear to a lot of us hearts, and that is sexual dysfunction or erectile dysfunction among veterans. And the statistics are very, very, very impressive for the incident rate of veterans with it's up to 50%. Upwards of 50% of veterans suffer one form of sexual dysfunction, whether it's, there's so many different forms of premature ejaculation, whether it's, delayed ejaculation, female sexual arousal disorder, erectile dysfunction. There's so many different types. One of them or another the veterans will fall into one of these categories, right? So, and it's not a topic that people like to just kind of say, oh yeah, I like to talk about, how I can't get it up, or it's not a dinner topic conversation per se. But I think it's important to kind of get out there and let people know that it is okay that these things do happen secondary to a myriad of reasons. And just getting folks to talk about it and kind of bring awareness to this is kind of, to me, it's kind of important. And of course, throughout my shows, if you guys don't know, Brotherhood of Healing is a podcast that is dedicated to veterans and anybody really who is interested in knowing about health issues that we go through as veterans. And other topics that are germane to veteran affairs and veteran issues, right? So, to no further ado, so some of the things that we can talk about today is understanding the dysfunction, right? A lot of veterans have this. People say, why is this so high among veterans? Well, a lot of veterans suffer from PTSD. And when you suffer from depression and anxiety, PTSD is sometimes organic or inorganic to the PTSD. You have additional comorbidities, and what tends to happen is that the medications alone can cause that. A lot of the medications will folks will suffer from having problems in that department. So already as it is, you have someone who is depressed and who has zero libido or has zero ability to achieve an erection. So there's no release. There's no form of a sexual release of sorts because of that. So what do? They go to the VA, and I'm not really 100% sure if the VA, how good they are about that. That have probably been a very good question to research prior to getting on the show, but I know that it's widely available, all the different things. My only request is whoever you go see, whether it is the VA, whether it's your primary care provider, whoever, make sure that they're versed in sexual dysfunction. Some people will go as far as seeing someone for just men's health. And that it has to do with things like your prostate or diabetes and other things that can cause, the sexual disorder. Never mind the mental aspect of erectile dysfunction or sexual dysfunction, right? So the impact, of course, is strained relationships already as it is. Folks come in with PTSD and they're already having problems with their marriage because PTSD, as you well know, is a disease of avoidance. If you're pushing your family and friends away, you're kind of trying to isolate yourself. And so not only is there that, but there's also no intimacy. So without that, you're wondering, okay, what can I do? My best recommendation is if you do have VA benefits, is I would ask my question to my primary care at the VA. I would start there and say, "Hey, listen, what can I do about this? This is what seems to be happening." And I think as a society as a whole, um, and I think that people are using these drugs like sildenafil or tadalafil or some of these medications that help with erectile dysfunction earlier and earlier. Whereas before it was mostly folks that were in their sixth and seventh decade of their life where things weren't working as well and what have you and so on and so forth, right? As long as your heart was healthy, you can get Viagra. But now we're finding that the younger and younger generations are using that, and I think a lot of it has to do with, for just a lot of maybe the estrogenic foods that we're eating that's causing a lot of this. That's just killing our testosterone, and those kind of things. I feel that that is something that is probably something that we're ingesting. Um, I don't, of course, it's not my field. It's my field is psychiatry, pain management, and orthopedics. So, sexual dysfunction, in a way, it kind of falls a little bit under psychiatry because we want folks to be, even though we don't prescribe medications like that, but we can definitely get your patients to the right source, right? But it also we understand how that can affect their mental health and vice versa. It's a two-way street. Um, so some of the treatment options, of course, we have medications, hormone replacement therapy, testosterone injections, creams or pellets. We have psychological interventions. This is really important, actually, because you'd be surprised how much of sexual dysfunction is stems from you being inside your head, meaning that sex is probably about 80% mental and the rest is physical. Um, and believe it or not, if you are well inside your head and you can't get past the block, uh, you may want to seek a behavioral health specialist in sexual dysfunction, and they have folks that do that. Okay, lifestyle changes, exercising, eating right, taking care of yourself, reducing the amount of alcohol and drugs and things like that, especially like tobacco. I mean, these are all things that can contributors. If you're diabetic, just know that you're type 2. This is how it kind of flows into that realm, and it's another cause of sexual dysfunction, right? So some of the, like I said, some of the there's tons of literature out there that you can look up on it, depending on what your symptoms are. Don't be afraid to speak up and going to see your doctor. It's very important for the relationship. It's very important for a lot of things because some people just express their love and their affection through the act of sex. Um, I think guys more than women. I think women are probably more of the emotional side, more of the mental side, but guys are more of the physical intimacy, and I think that um, that's a barrier that need not be there, basically. So, um, I think that if you're having problems with your spouse, I think it'd be well worth a trip to making a few appointments as a couples therapy to kind of hash out what the main problem is. And sometimes it comes out, it's just a block, a mental block that the person has. They can't get past certain things, or they're just easily distracted by other things, sounds, and try to mitigate all that. Try to mitigate all those things that cause you to just kind of, fly off the tangent and not able to achieve or maintain an erection, right? So again, uh, as veterans out there, and I talk to a lot of veterans all the time, and jokingly, it's of course because it's a topic that is not suitable for dinner, a topic, but because people might like to make jokes about it and that sort of thing. But really and truly, they really, a lot of them do suffer from this. I think it's funny how few of them actually go get help for it. So, it's so I keep telling folks, hey, man, this is important stuff here. Um, yeah, we kind of went over some of the different types of sexual dysfunction. Um, you know, there are like I said, there's tons of devices and things that you can get that can help. Um, Different sexual aids that can be implemented into the act of intimacy. Um, but when you have a 50% of veterans who suffer from this, and that's the ones who we have documented. We don't have the ones that are not saying that's their problem. We don't have that, so there could be it could be a lot higher. So when you have that, I think it's kind of important to kind of address it. So just to kind of recap, hey, it's really easy. Don't be ashamed. Don't let people shame you for that. It's totally fine to go see your primary care if you're having some issues in that department. I would say that if you have a good relationship with your spouse, I'd include her into this whole thing. Kind of make this a husband wife or husband or boyfriend girlfriend type of um, uh, thing where you both are part of the finding the solution, opposed to just leaving you out there on your own, kind of just figure it out, and finding the right care for it too is really important. And oftentimes being diagnosed correctly is key, right? Because some people say, well, I this is what happens, and they won't tell you that um, that they are unable to maintain an erection. They can achieve an erection, but they can't maintain it, or they can't even achieve an erection, and so on and so forth. So it's kind of important to be able to diagnose exactly what the source is, and fix that. There are a lot of things you can do, like we talked about, the alcohol and drugs and medications and things like that. I'm not saying to stop taking your life-saving medications. But I am saying that talk to your doctor, and there are alternative medications out there that are not so taxing on your sexual health. So, and a lot of doctors, for instance, when I was practicing, I'm retired now. I decided to retire this year, but when I was practicing, I get a lot of people come in for depression, what have you, and they would say, I tried this, I tried that, give me this, this one gives me problems in the bedroom. Quote unquote. And I said, okay, let's get you off of this one. Let's put you on this one. If you're of a certain age group, where you're still very sexually active, then I would consider, a what we call a SNRI versus an SSRI. And those are the medications that I usually transfer my patients to, and that seemed to work as well. So knowing that your provider will know which ones are and which ones aren't, because they're the ones they hear from their patients. Patients come in, doc, I don't know what you gave me, but man, I can't have this anymore. My wife is mad at me, that sort of thing, right? So so yeah, but like I said, and sometimes just a matter of finding the right therapist as well. They have cognitive behavioral therapy for it. They have different couples therapy. They have different things that they can do, and that's aside from treating you for your PTSD or depression, anxiety. This is on top of that. This is separate to that, because it has to be focused on your sexual health, right? Um, worst case scenarios. There are pills, there are creams, there are injections, there's everything out there on the market. All you have to do is type in Viagra, and the powers to be on the other end of the internet will flood you with all sorts of uh, options. So, that's why I think it might be a good idea to, if you're having problems, go see your primary care and have them kind of help you out with that. But so so there's just really the kind of the topic at hand. I wanted to make sure that we all had a time to kind of discuss this, because it affects your behavioral health. It affects your well-being. I mean, how many times have you heard somebody, say, "Wow, he's in such a bad mood all the time." Well, it's because he's not getting any, and that's probably very true to that. There's probably a lot of truth to that being said. There's a lot of frustration and anger and things that build up in the background because you're not being healthy in that department. Okay. So, no further ado. This is the end of my episode. I hope you enjoyed it. Please feel free to comment and to reach out. Again, this is Dr. Mark Rossini, and we'll catch you next time. Thank you for tuning in to Brotherhood of Healing. If you're hearing this message, you've listened to the entire episode, and for that, we want to thank you from the bottom of our hearts. If you enjoyed today's episode, please take a moment and leave us a review on Spotify or Apple Podcasts. Your feedback helps us grow and bring you even better content. Don't forget to hit the subscribe button so you never miss an episode. Until next time, keep your powder dry and watch your six.